Hey, how you guys doing? This is Dr. Chaffin. I'm at the Simply Implant Institute. I'm one of the senior faculty members here. In the video about to watch, I'm gonna make it really simple. There's a procedure out on the market, it's called hybrid dentures, all on 4, teeth in a day. While that's a great prosthetic, that prosthetic was meant for patients that don't have a lot of bone. And, which is a good prosthetic for patients who don't have a lot of bone. I mean, these patients are not really great candidates for good dentures. The dentures kind of flap around a lot. So it is an advanced prosthetic. It's excellent. And that's obviously is a prosthetic that a lot of people watching this video know about. What my problem is in this video that you have, you're gonna see a guy named Gary. And I'm actually showing my students this perfect case. Gary was recommended 2 hybrids, one on the upper, one on the lower. I'm glad he came to see me because quite frankly, if you did hybrids on this guy, it would be malpractice. He had a lot of teeth in the front, all the way across. He had a few missing teeth here, nothing big. None of these teeth needed to be worked on. I think 1 crown. These teeth down in here, and you'll see it in the video, these were all fine. He needed 2 implants over here and a couple crowns here. That's it, very simple treatment. And he went to one of those full mouth places that do that, and they recommended, and they would have done it, a full mouth reconstruction, and they would have removed all his teeth, they would have removed all his bone, and that's completely unethical in this case. And I put a warning out because I see this time and time again, over and over again, these patients that come in, they do not need hybrids, they have too much bone, they're not candidates, and they've been recommended this course of treatment. I don't know if it's due to money, because these are $50,000 cases if you were to do that treatment, or what, or non-training. But this is something that I see, and I give a warning to anybody watching this video. You're gonna watch this video and you're gonna see this guy has a ton of bone and he has his teeth. It's just like mine. Are you gonna do one on me? Absolutely not. And any doctor that does or would be doing malpractice. It's crazy, it's nuts. If you have a candidate that needs that procedure, then great, they're a candidate. They have no bone, you don't really have to reduce anything. It's a very good prosthetic, and I'm very, very pro for that, only when it's necessary and you have those cases that need that prosthetic. So enjoy that little video here, but I wanna make it really crystal clear what you're seeing in the video, and my students were absolutely floored, all right? So anyway, have a great day, and see you in the next course.